All right, thank you guys for coming to my ISM final presentation night. My name is Alex Siegel, and I will be presenting my topic over anesthesiology. To start out my PowerPoint, I wanted to go ahead and play a little inspirational video that I found online that I thought was really good. And I hope that you guys find it interesting too.
In a remarkable turn of events, Apple bought Next, and I returned to Apple, and the technology we developed at Next is at the heart of Apple's renaissance. And Maureen and I have loved it. I'm pretty sure none of this would have happened if I hadn't been fired from Apple. It was awful tasting medicine, but I guess the patient needed it. Sometimes life's going to hit you in the head with a brick. Don't lose faith. I'm convinced that the only thing that kept me going was that I loved what I did. You've got to find what you love. And that is as true for work as it is for your lovers. Your work is going to fill a large part of your life, and the only way to be truly satisfied is to do what you believe is great work. And the only way to do great work is to love what you do. If you haven't found it yet, keep looking and don't settle. That's what all matters at the heart. You'll know when you find it. And like any great relationship, it just gets better and better as the years go on. So keep looking, don't settle.
Alrighty, so for me that video really kind of just represents not just me in particular, but more of kind of the senior class in general and how we're moving on to a next phase in life, which is we're unaware of. We don't really know what exactly is going to happen. You know, each moment is a stepping stone, but it's more of kind of the unknown that we're going into. So for me, I love helping people, and that's why I really want to go into anesthesiology, and I hope that everybody pursues what they love and always lives by that. So a little bit about me. I am now 19 years old, just had my birthday last week. I'm a senior at Frisco High School, and I'm a first-year ISM student studying anesthesiology. I'm involved in health science through the CTE Center, so that gives me another bit of exposure to the healthcare field. The price of success is hard work, dedication to the job at hand, and the determination that whether we win or lose, we have applied the best of ourselves to the task at hand. That's a quote from Vince Lombardi. It really shows how it's not about if you're the best at something or if you're, the winner or the loser, or you come in second or third place. It's more about as long as you dedicate yourself to something and you put 110% effort into that, nobody can lose. Now, in ISM, my mission is to gain a high level of knowledge in the field of anesthesiology through the guidance of a mentor. I will strive to learn to heal and aid those in need and treat all I encounter with a high level of professionalism. Now, for me, I always want to care for people as best I can. So treating everybody with a high level of professionalism is definitely a big thing to me. Now, a lot of people know anesthesiologists, okay? They put you to sleep when you have a surgery, but they do a lot more than just that. Basically, anesthesiology is the practice of medicine dealing with the relief of pain and the care of patients before, during, and after a surgery. Now, what is an anesthesiologist in particular? They're commonly perceived, like I was saying, as just the person that puts you to sleep and wakes you up, but they serve a more central role in an operating room due to their part in regulating critical body systems. Without an anesthesiologist, there would really be no way of being able to effectively keep you sedated during a surgery without having any complications or problems. So they play a really important role in that, and in the fact that they are experts in administering pain medication and alleviating pain from patients. Now, for me, why I want to go into anesthesiology is it's a great field. It's rapidly growing, it's readily available, and you always need an anesthesiologist for every kind of surgery. You can't really go into an operating room and do a surgery on a patient without having anesthesiology. Now, the field, it's always evolving because medicine is a great field where you have changes occurring all the time, and it's still competitive, but it's not as competitive as a surgical field or anything like that. Now, I'm going to kind of highlight some of the research I did in my first semester in ISM. My first research assessment was about global health outreach programs, and I learned that a lot of anesthesiology residents aren't really aware of the opportunities to go to other countries and help out and perform care on third world countries. And on my second one, I evaluated the effects of social media on the medical field in general. Now, the problem with social media, Facebook, Twitter, everything like that, is people aren't as aware that what you say online, just doesn't go away. It can affect people in adverse ways. We don't always look at how that happens, and we don't always look and say, oh, this can be a serious problem. It's definitely an issue with the medical field because you need to be protecting patient records and information, and even saying something online such as a patient name or address can definitely be a big issue when you're talking about healthcare laws and things like that. My third assessment was focusing on the effects of teaching professionalism to anesthesiologists in training. Overall, professionalism is a huge thing that you want to have in the medical field. You want to have good ethics, and you want to be able to have a good quality of care for others. On my fourth assessment, I discussed how substance abuse can be avoided with anesthesiology departments, and particularly anesthesiologists in training. This doesn't just pertain to anesthesiologists, it's really more doctors in general. When you have a high level of stress, a high level of competitiveness, and a lot of times it's too much for certain students, so they turn to drugs and alcohol to alleviate that stress. And on my fifth research assessment, I talked about how the current changes in healthcare are causing problems between various medical fields, where right now some hospitals are trying to basically train nurses and lower wage employees to perform higher paying jobs, because if they can train the nurses to do the job of the doctor, then they don't have to pay the doctor the extensive amount of money. Now, there's a barrier when you're talking about this, and in my opinion, I don't think that the amount of training that you could give someone that's gone through 2 years of nursing school versus gone through 4 years of medical school plus 4 to 6 years of residency or specialization can really equal each other. Now, with my interviews, my first one was with Dr. Ari Fleshman, which is actually my mentor. He works for Metro Anesthesiology, and we really talked about the basics of anesthesiology, because I wasn't really sure on what the whole package was. I wasn't sure on what exactly anesthesiology was. I knew, pretty briefly what it was, but he gave me a lot more detailed analysis and how anesthesiologists are employed or how they work with groups and various things like that. My second interview assessment was with Dr. Mark Margolis. He also works for Metro Anesthesiologist, and he talked to me a lot about how the healthcare field is constantly evolving and what it is now for him versus what it will be for me in 10 years or whenever I get to that point is going to be very different. And that's just something that you have to learn to evolve with and get the skills needed to work in that kind of condition. My third interview assessment was with Dr. Roy Ivy. He also works with Metro Anesthesiology, and we spoke about a lot of the impacts of undergrad college and how that really can affect your future. The better you do throughout college, the better things will be in the future overall. And he gave me a lot of great advice about college decisions and different things to look for when I'm trying to go to medical school or just trying to get into a good medical program. And on my fourth assessment, I spoke with Dr. Ramsey Stone, which is actually a general surgeon with North Texas Surgery. Now, this was a big change between just talking to anesthesiologists that in my previous interviews, because I got the chance to see what it's like on the other side of the operating room. Not just to see what the anesthesiologist does, but I also got to see how the surgeon is affected and how that's different. And Dr. Stone specialized in minimally invasive surgeries, and he taught me a lot about the major differences between anesthesiologists and surgeons, how their time or their schedules can be different, just how everything they do is different. Anesthesiologists are more, you sit down, you talk to the patient for 30, 45 minutes before the surgery, you go into the surgery, and then you're done, and then you're on to the next patient. With a surgeon, it's more of a long-lasting relationship that you create with an individual. And my last interview assessment was with Dr. Kirk LeBlanc. He works as an anesthesiologist at the USAP, which is the United States Anesthesiologist Partners. And he taught me a lot of the differences between large and small scale anesthesiology groups and how that really comes into play with the new healthcare laws and everything like that. He was saying that a lot of groups are banding together to create a more tight-knit community so that they have more influence in respects to policy and lobbying for certain things. Now, my mentor, a little bit more about him. Again, Dr. Ari Fleshman. He joined Metro Anesthesia in 2008. He's a graduate of University of Texas Medical Branch in Galveston, Texas. He completed his anesthesiology training at Emory University in Atlanta, Georgia, and he's a member of the American Society of Anesthesiologists and the Texas Society of Anesthesiologists. And I'm going to highlight a little bit on my mentor observations and what I've been doing with Ari. First, observation I saw was a gallbladder resection, which that was at Texas Health Presbyterian Hospital in Rockwall. And during the gallbladder resection, I learned about a lot of the various medications used in anesthesia in general, to put people to sleep, to sedate people, things like that. And then I also learned about the anatomy of the gallbladder and the problems that can arise from it from the surgeon. The surgeon was very nice and gave me a real detailed step-by-step procedure on how he did the resection. And I learned about some of the monitoring devices that are utilized by the anesthesiologist during a procedure and how to kind of evaluate all the information, because it's a little overwhelming. There's a lot of numbers and things all over the place, and if you don't know what each thing means, it can be a little confusing. And my next mentor observation was an appendectomy. It was also at the same hospital. I learned a lot of the anatomy of the appendix and complications that arise from it with an inflamed appendix or appendicitis. And I was actually able to observe a laparoscopic removal, which is where instead of cutting the patient open, they use little laparoscopic devices, and they look like little, I guess you could say, little straws, and they put 4 of them into the patient on various places around the abdominal cavity, and they go ahead and have a camera. There's a camera on the end of one of the devices, and they use that with little teeny tweezers and scissors to cut away the various structures that they need to. Now, my original work is really, my product and original work go hand in hand, because this is a long-term product that I had to work on, and so overall they kind of mix together. So when I'm talking about my original work, it's not necessarily a different product than my final product will be. Now, when I first was thinking about what I wanted to do for my product, I thought that, okay, I want to kind of make the operating room easier, make it more safe, make just overall the experience of patients a little bit better. So I was like, well, there's cords and monitors and everything all over the operating room that take up space, and they're honestly, it's just not effective. So I designed a system that would allow vital signs to be taken wirelessly, and it could be implemented on large-scale operations such as entire hospitals, and it would be one system that can be used throughout the healthcare stay. So basically, the concept of it is you get a blood pressure cuff, you get a pulse oximeter, which is the little device that would go on your finger to take your oxygen level and your pulse, and then you'd get a EKG telemeter, which is what monitors your heart, and all those devices would be connected into one. I mean, they're separate devices, but they all communicate with a module on the EKG telemeter that would allow all those vital signs to be taken into that module and then sent to a monitor wirelessly without having to constantly take off and remove blood pressure cuffs and pulse oximeters and all that, all having all those cables all strewn all over the entire patient area. Now, you can kind of see that in a typical patient room, this is kind of what it looks like, pictures-wise and everything like that. There's a bed, there's monitors and everything like that. There's various devices that are going to be connected to the patient, which really restricts the patient's movement and freedom. A lot of times when you want to move a patient, you have to remove a device from their arm or finger, or remove an IV or anything like that, just to be able to have them, for instance, go to the bathroom. So the system and procedure for taking vital signs on patients, I would say, is largely outdated. I mean, it's been the same for a very long time. Nothing's changed, and it just isn't effective. And you have to use so many different devices that it just is all over the patient. The patient themselves, and it just isn't clean or effective at all. Now, the monitoring equipment tends to become tangled by constantly adhering and removing from patients. So you're taking it off, you're putting it on, you have to untangle it, it's all over the place. And really the big problem with this is it increases the risk of transmitting communicable diseases and infections in a hospital. That's the number one thing that these vital systems, that's the number one problem with these vital systems, is the fact that you can get a disease from them or an infection from them because frankly they're not really cleaned effectively, and most of the time they're not given, that patient doesn't keep the blood pressure cuff or the pulse oximeter. It's removed and then readhered to a different patient, and it might have not been cleaned, and that patient originally could have some kind of disease and now it got transmitted to someone else. Now, how are vitals taken today? They're taken by connecting an EKG machine with 3 to 12 different leads, and you can see on the left picture that's usually what it looks like. And then your blood pressure would be taken. After that, you have a pulse oximeter that checks your pulse and oxygen level. That would be connected to your finger. And then your temperature has to be taken. That can be usually taken orally or with a forehead temperature monitor. And my solution was a wireless device, like I said before, that would communicate with monitors throughout the hospital. Each device would be placed on the patient at the beginning of the hospital stay and would be there throughout their time at the hospital. And it would allow you access to the patient vitals without the need to constantly apply new devices, elimination of clutter, decreased risk of contacting and spreading communicable diseases, and increased quality control for hospitals. And overall, this is what I envisioned it looking like. It would be, that's the main module in the center of the chest. There would be 3, 4 different EKG leads connected to you, not very much, and it's a lot better than having to have cables all over your body. Then you would have a blood pressure cuff that could be wireless, and it could be on your arm or it could be placed in the room, but it would stay with you the entire time they were there. Then a wireless pulse oximeter that could be easily put on your finger without having to go ahead and clean it off and connect it to a monitoring device or anything like that. Okay, now I have a video that I made in the hospital that actually details the how this product would work and the inefficiencies of the current technology. And let me show that to you guys. Let's see, here it is. It's a little long, but not too much, and it does definitely detail the inefficiencies of the current technology. You can see how all the various different devices are already attached to the patient, and the cords are already tangled up. And that, when I say first point of contact, that's talking about how many times you actually physically connect a device to the patient and remove it from them, throughout the various stages in the hospital. Now, from here, I was moved to the ER room, and they also have to take another set of vitals here. You can see that I've already had to have 2 different monitoring devices attached to me, and I haven't even seen a doctor. I literally walked into the ER and then went to a room and had to get my vitals taken. Now, here I was admitted to the hospital. I was taken to a room in preparation for a surgery that would be happening later in the day. Now, a completely separate device or monitoring device already connected to me. You can just see how this is very inefficient, and having to do it over and over again just leads to more and more issues with patient safety and the transmission of diseases and infections. So I haven't even gone into an operating room or have had anything done on me other than a doctor looking at me, nurses taking care of me, and I've already had 4 different monitoring devices connected to me. So just going to the operating room, I had 5 different monitoring devices connected to me, and I've got cables all over the place. And you can see in the operating room there were tons of different monitoring devices there that just clog up the space that you have and really it can cause harm to the patient and to the nurses and doctors there. And you can see right here how the cables are all over the place. They don't even have the chance to, unravel them or anything like that. If an actual patient was coming to the recovery room, they're not going to sit there and untangle all those cords, and it's just not comfortable. And you can see how I have a blood pressure cuff connected to me from, across a monitor. It's crossing over the bed. It's probably going 2-3 feet just to get over there. So that, eliminates all that space in there that you can't really cross between. Now, after recovery, I'd be moved back to a room, and this is where I would have like an overnight stay. And again, I have to get my vitals checked, and on average, they do take your vitals usually every 2 to 4 hours each, if you're staying overnight or in hospital. And it's good to take vitals, but having to have a patient come or having to have a nurse come in there every time to take your vitals and use a different device and a different blood pressure cuff, it just isn't effective. And they're not cleaning them, they're not sanitizing them, because the nurses have a lot of stuff to do, and they might forget or they might lose track of what they're doing. And if it's not cleaned and I had some kind of disease, I can transfer that to the next person that's using that device. So that was the big video that I made for my final product. Now, overall, my actual product that I'm creating, I'm still working on creating a prototype. It is a little difficult to get, manufacturing and things like that for this kind of stuff. But it basically would look like this device right here. You know, just that module would connect to